Hi, I'm Art Kaplan. I'm at the Division of Medical Ethics at NYU's Grossman School of Medicine. Well, we all live in the age of social media, lots of information being transferred and transmitted to patients, your patients, about COVID, about how bad the epidemic is, about how to treat the infection, about how to prevent getting the infection. And it's making a real mess for physicians in terms of trying to manage misinformation. So at one end of the spectrum, there are people, sadly, who are trying to drink bleach. They're hearing that pool disinfectant might help them. They're trying to get their hands on anything that they hear is a disinfectant, and they could harm and hurt themselves. People have already died trying to take those substances. In the middle comes entities like hydroxychloroquine, which is Donald Trump's favorite drug of choice, but many others tout it as well. HCQ is being touted as something that can help people recover if they get sick or prevent you from getting the virus. Now, the FDA and many other groups says no evidence. The clinical trials that have been done in terms of treatment efficacy show nothing and potential harm. There are a few studies still running on whether it helps block acquisition of the virus, but early returns there seem to say no. So that's one where patients are getting mixed messages about take this prophylactically, or if you get to the hospital, ask for it, ask your doctor to give it to your loved one if they're very sick. And then at the other end of the spectrum, there's lots of social media advice circulating around about masks and saying that masks are good and they help cut back on transmission significantly. The better the mask, if you will, the better the impact. And that COVID is taking a terrible toll, that there are many tens of thousands of deaths and millions of infections. But some patients and Americans believe it's a hoax. Others say that masks don't do anything, they're just a plot. So this is, if you will, sound advice being undercut by conspiracy, rumor, people just doubting what experts say. So where is your responsibility in the middle of this sort of spectrum from outright dangerous, bad information to somewhat controversial, middle-of-the-road information like HCQ, to proven, established behavior like masks, where patients still, some of them are resisting or saying, I don't need it, or the whole thing's made up, or it's a political ploy to get Donald Trump removed from office, or to advance the interests of mask companies, or whatever underlies that belief. Well, I think your first obligation is to be aware of what's floating around on the internet. As painful as it may be, you have to take a visit and see just what's circulating out there in terms of health claims. Be aware, be alert, because you may be dealing with a patient who believes either the bad and dangerous and outright harmful information, or you may have to engage them on something like mask wearing in terms of why it's important, when to do it, when you don't need to do it, and why. I think it's also important to ask patients, what do you think about, if they ask about HCQ, you can tell them what I just said, here's the information. It doesn't seem to hurry anybody recovering who's been infected. That's knocked out of the box and potentially dangerous. You shouldn't self-medicate with it. We don't know what dose to use. And even for preventing the disease, the evidence there is not in a positive way, and what is in is negative. So I think you need to basically inquire and say, what do you believe? If someone comes into the office, ask, are you wearing a mask? Why not? Why don't you think that helps? Do you social distance? Why not? Do you try to isolate yourself as much as possible, particularly if they're in a risk group, diabetics or heart disease or asthma, immune diseases? You need to remind them that it's especially important for them to think about where they go or where their kids might go to school and so on. Some doctors have said to me, that's all great, but do I have to get into the social media fight? Should I be posting? Should I be saying something? And I want to encourage you to do it knowing that the blowback can be vicious, nasty, and out of control. When I try to correct mistakes, misinformation or outright dangerous information on Twitter or on Facebook or other social media sites, I have a lot of people bark back at me and say, bad things about me, or wonder why I'm in the pocket of the pharmaceutical industry, or what my political beliefs are, and so on. But that's just social media. My attitude is I take the blowback and I don't let it bother me very much. You may have a different attitude. Many people find it just personally too emotionally upsetting. They don't want to get into it. But if you can deal, I do think it's important for professional voices, medical voices, scientific voices to get out there into the mix. Too often, social media is just a place where conspiracy theories, misinformation, and dangerous information are allowed to thrive without any comment, without any pushback. I think if you can do that in your community, whether it's social media or talking on a webinar or speaking up at a high school class online, these are important things, very important, that you can do. People respect doctors. They particularly respect their doctor. If you send accurate and information and point out that that information changes and evolves, and point out that they have to keep tracking what the legitimate science and research shows, I think you can make a valuable contribution. It may come at a price, but I think it's a price worth paying. And I hope that you will try to at least set the record straight in an era where things are often not accurate when you find out what your patients believe based upon what they see on social media. I'm Art Kaplan at the Division of Medical Ethics at the NYU Grossman School of Medicine, and thank you very much for watching.